Hello, and welcome to the AMA's Steps Forward podcast series. We'll hear from healthcare leaders nationwide about real-world solutions to the challenges that practices are confronting today. Solutions that help put the joy back into medicine. AMA's Steps Forward program is open access and free to all at stepsforward.org.
Hi, everyone. Welcome. My name is Dr. Chen, Physician Director of Practice Sustainability here at the AMA. On today's podcast episode, I'm joined by Dr. Natalia Rost, President-elect and Vice Chair of the Committee on Public Engagement for the American Academy of Neurology, the Chief of the Stroke Division at Massachusetts General Hospital, and Professor of Neurology at Harvard Medical School. Welcome, Dr. Rost. Looking forward to our conversation today.
Thank you for having me.
So I'd like to lead off by talking about the American Academy of Neurology recently joining the AMA's Behavioral Health Integration Collaborative, which is a group dedicated to catalyzing effective and sustainable integration of behavioral and mental health care into physician practices. Dr. Rost, before we dive in, could you share a little bit about yourself and your background with our listeners?
First and foremost, I'm a neurologist. And as you know, neurology is the medical specialty that is dedicated to diagnosis, treatment, and management of diseases of the brain and nervous system. I am also a clinician investigator, and I have a large research program at Mass General Hospital that is focused on vascular cognitive impairment, recovery after stroke, brain resilience. And so my research work is really quite intertwined with the concept of brain health overall. And so my job, so to speak, interests are very much aligned in this space. As you know, neurology covers a vast spectrum of the disorders of the brain. They include, but not limited to, Alzheimer's disease, other dementias, stroke, ALS, traumatic brain injury, epilepsy, MS, migraine, etc., including pediatric neurological disorders. And neurology really has a long-standing and established clinical tradition, which includes the bedside neurological exam, which I think is a very elegant way to interrogate every sense, movement, every cognitive function of a human being. But we also are constantly finding ourselves at the cutting edge of innovation and discovery in medical sciences. And so that's why it's so exciting. And most recently, the advances in imaging of the brain, ability to decipher the neuronal signals that we can measure in all sorts of direct and indirect ways through brain and monitoring devices, and truly at the leading edge also of genetic and neuroimmunological breakthroughs. And so in brief, neurology is no longer a subspecialty of diagnosis and adios as we've been labeled decades ago. We're thriving, we're dynamic, we're hands-on, bring about the cures type of specialty with hundreds of diagnostic and treatment options for dozens and dozens of diseases. And that's how I identify in my professional life, in my career, and also in my involvement with the American Academy of Neurology, or the AAN. And really, I think of us as neurologists as custodians of the brain. We are trained, primed, and we're specialized to lead the brain health revolution that is really happening right now.
You've outlined the breadth of your specialty neurology very beautifully here, especially all the patients that come under your care. We are talking about behavioral health today, so I wanted to ask you, how do you think integrating behavioral health care into neurological care is important?
I would say the simplest answer is that the brain, the very organ of which neurologists are specialized to take care, is the single source of behavioral health, or in sickness, on the other hand, of behavioral disorders. So we have to understand both professionally and at the level of public education that brain is the control and command center of the entire neurological system, of our bodies, our senses, through our emotions, and consequently, our behavior. So behavior is really a product of the brain function, and that's why as neurologists, we already see so many patients in our clinics with behavioral and mental disorders that are born out of the organic brain disease. So I'm a vascular neurologist. In my stroke clinic, I often see depression in my middle-aged and older patients who are struggling in their recovery, or anxiety, or even post-traumatic stress disorder, like in those young stroke patients who have been traumatized by the stroke event itself and now struggle to regain their functionality as productive members of the society. They are often mothers and fathers to small children or main caretakers for their patients. And obviously, their organic brain disease due to stroke is affecting their behavioral health. And of course, there is so much more impact from behavioral disorders in neurological clinics where we treat patients with dementias, epilepsy, multiple sclerosis, traumatic brain injury, and others. These complex cases neurologists handle every day in their practice. And that's not to mention the burden of the neurological disease on the caretakers and their mental health. And that's why we need to be aware of it and be proactive in seeking team-based solutions across the broad swath of issues where neurological and behavioral health overlap.
Can you give me any examples where the integration of behavioral and mental health care has had great impacts on both the neurologist and the patients that they serve?
I will be frank with you that at this time, there is a limited, I would say, toolbox or a suite of tools and resources that are available to neurologists who seek to integrate behavioral health care into everyday practice. I would say some of the more effective ways where I've seen the integrated behavioral health care into neurology happen in those, for example, institutions where neuroscience service lines, I should say, included neuropsychology and psychiatry, or where there's an integration of neurobehavioral practice and development of those practices with the neurological department, as well as integration of neuropsychology, psychopharmacology, social work counseling, etc. And if you took a patient with a complex organic neurological disorder such as Alzheimer's disease or related dementias, we know that behavioral changes that accompany that disorder are progressive, relentless, and in many cases require multiple years of care and multiple members of the multidisciplinary team to make a difference in the patient's life and the life of the patient's family. So I think that there are opportunities to engage across the specialties, and I also think there are opportunities to improve our engagement. But I think that one thing is undeniable, that the neurological care and behavioral health are very closely interrelated.
You mentioned that there's a toolbox that we would like to try to develop for all specialties, both primary care specialties and non-primary care specialties. And I think that's one of the things that our Behavioral Health Integration Collaborative is trying to do, is to try to build that toolbox. So I'm glad that you mentioned that. Switching gears a little bit, I want to know a little bit more about what AAN is doing, specifically on what I've heard to be the Brain Health Initiative. Could you explain what this initiative hopes to accomplish and how behavioral health integration and mental health integration is important to achieving its goals?
I'd be glad to. And first, I would like to start by just saying that the American Academy of Neurology, or the AAN, is the largest professional organization of neurologists and neuroscience professionals in the world. We are 40,000 plus members strong and growing. But as neurologists, we wanted to be, visionary and strategic in our take on brain health. And so prioritizing brain health as a key aspect of public engagement is what effectively launched the AAN's Brain Health Initiative in 2021. And since then, we have released a brain health platform and a position statement, which included our new definition of brain health, the strategic objectives of the Brain Health Initiative by the Academy, and the AAN's action plan across lifespan, as well as the National Brain Health Vision 2050. All of these have been published open access in Neurology Journal in September of 2023. But there are two pieces that I wanted to specifically highlight. One is the brain health definition. As you know, brain health is a fairly complex construct that for many years didn't really get a lot of traction with the public, and mostly from my standpoint, because of the multiple angles from which we have been approaching it. So this way, when we were coming together around the concept of brain health through the Academy of Neurology, we planned it as a first strategic objective to define or derive a definition of brain health as a neurologic concept. And we did it through a lot of consensus building exercises involving dozens of brain health experts inside and outside of the academy. And so our official definition basically reads that brain health is a continuous state of attaining and maintaining the optimal neurologic function that supports one's physical, mental, and social well being through every stage of life. And the reason I wanted to highlight that is because you can see we organically incorporated mental well being, ergo behavioral health, in our definition because they're so tightly interwoven. And that's basically one of the strong foundations for our collaboration.
I'm very glad to hear that with the Brain Health Initiative, that mental well-being is a part and parcel of your goals. I think that aligns perfectly with what the Behavioral Health Integration Collaborative is trying to do. In terms of your membership within the AAN, are there members out there that have embarked on this journey of behavioral health integration that have tips and advice for the most effective ways to integrate behavioral and mental health care into neurology?
I think the most successful models came from developing team based approaches, but we do have successful examples of integration, and those examples come again along the ways of particular neuroscience service lines at some academic institutions that may include neuropsychology, psychiatry colleagues, etc. Some neurobehavioral practice developments that are positive in in that space, and also collaborations with neuropsychologists, psychopharmacologists, social work counselors, et cetera, et cetera. I think that one of the examples that's very specific for neurology, perhaps you've heard about the growth and development of the field of functional neurological disorders. That's kind of a neurological field that is really bordering the kind of cutting edge of behavioral developments, as well as some of the cross training that happened between the neurology and psychiatry programs that really has been a success.
I'm glad you discussed some of the examples where there's been a lot of success with the team-based care. Have those folks shared with you what the pitfalls or challenges they've come across on their journeys to try to integrate behavioral and mental health care within their practices?
There's a growing demand on neurologists for our expertise in all things brain, so to speak. And as you know, with aging of the population, the burden of national and global, for that matter, neurological disorders is growing. But at the same time, the ability to provide effective neurological diagnosis and treatments is expanding and, making a different demand in our practice in that way. And we're absolutely excited for our patients and their families to be able to bring them relief and cures. But our profession will need to grow and expand if we will be delivering on our promise of this integrated brain health care that together with organic neurological solutions will also address behavioral health. And so that's why, I think the growing of field of preventive neurology in the future is a key part of the AAN's vision. And that can bring together cross-disciplinary professionals. In fact, I think we need to grow this kind of a cadre of young professionals who may come from different subspecialty training, whether it's primary care, pediatrics, OBGYN, cardiologists, gerontologists, psychiatrists, all of them, if we arm them with resources, time, sustainable solutions for their practice, and ability to provide preventive neurology care, brain health care, behavioral health care, kind of one size fits all, would be available to them, I think that they'll be more effective in this preventive brain health space.
What does AAN hope to gain from joining the Behavioral Health Integration Collaborative?
I think we understand that neurologists can't do it alone. I think we understand that the era of brain health for all requires broad collaboration between the multiple stakeholders. But on our end, we're excited to join forces with the AMA in supporting their behavioral health initiative because we know that we share so many priorities in that space. And because together we're more effective advocates for policies that benefit the overall brain health, including behavioral, we're better educators to our colleagues, to our patients, and to the public, and we're better care providers.
Wonderful. Do you have any practical tips or pearls of wisdom for other healthcare leaders, especially those primary care specialties that are now thinking about behavioral and mental health integration in supporting their colleagues?
Yeah, I believe that this is our moment to join forces on this issue. We have the momentum, and most importantly, we have the ear of our patients and the public. So, behavioral health is an integral part of brain health, and we need to project optimism and a constructive view of the future where we're focused on the patient with their complex health needs, and we're focused on finding optimal solutions to address them. And I think that's what at the organizational level, both of our organizations are doing. But we can start now to reach out to our colleagues in this brain health space, look for efficiencies in getting our mutual goals accomplished, and we can speak to our patients about the specific evidence-based practices that can promote both brain health and mental well-being. And we can educate the public about the need for kind of a grassroots advocacy and policy change for everyone's sake. Because if we are to reach that future of optimal brain health for all, we need to work together. And I actually firmly believe that we can.
Thank you so much for joining us today, Dr. Rost, and thank you to our listeners for joining us. Listeners can find out more about the AMA's Behavioral Health Integration Collaborative and the AAN's Brain Health Initiative in the episode description.
Thank you for listening to this episode from the AMA's Steps Forward podcast series. AMA's Steps Forward program is open access and free to all at stepsforward.org. Steps Forward can help put the joy back into medicine by offering real-world solutions to the challenges that your practice is confronting today. We look forward to you joining us next time on the AMA's Steps Forward podcast series. stepsforward.org.